talk about tracheostomy tubes. Specifically, the tracheostomy tube that I want to mention is the fenestrated tracheostomy tube and how the fenestrated tracheostomy tube works. Now, this is not a fenestrated tracheostomy tube, and you can tell that because, let's see if I can zoom in on this. This is a DCT, disposable cannula trach. So let me get one out and show you what a fenestrated looks like. Sometimes we decide to pull the inner cannula free, and we decide to cap trachs for a number of reasons. Now, another way to limit the use of a trach is using a speaking valve. And so when either a cap is placed or a speaking valve is put on, you're limiting the use of it. And the patient needs to either inhale and exhale or just exhale through their trachea and out their mouth and nose. And that's where a fenestrated tracheostomy can become helpful. It has, in the outer cannula, it has a little oval-shaped cut in it, so that when the inner cannula is removed, take that out. When the inner cannula is taken out of it, then the patient can breathe up through their mouth and nose while the trach may be plugged. Now, I would just caution you that you should do a leak test when you put the cuff down. Do a leak test with the inner cannula in place in order to assess how much air the patient's going to be able to move around the cuff. The reason I say that is you can't always trust the fenestration on the tube. This little hole can become easily plugged with sputum, and if the patient can't breathe around the trach, around the deflated cuff, then they won't be able to get any air at all. So how will you do this leak test? Well, it's simple. All you have to do is let the cuff down, put your finger over the end here, and ask the patient to speak and assess their breathing quickly. And the patient should be able to breathe around the trachea or to breathe around the trach tube. Now, this may mean having to change out to a smaller trach. This is a, I don't know if you can see that, but this is a, I believe it says a 6 fenestrated. It's kind of hard to zoom in on that. Yeah, this is a 6 fenestrated. So you may have to downsize perhaps an 8 to a 6 in order to give the patient enough room to breathe around this deflated cuff. Even better, if you're going to use it this way, is a cuffless trach. So a little information about fenestrations. So the point is, use fenestrated, but realize that fenestrations can become plugged and that these fenestrations can become crusted off in a few days too, particularly if there's not adequate humidification.
Come, baby, run for the shadow.